We wait for some viewers.
I think somebody's fan is making noise or something. Good background noise. है. Yeah.
Yeah. Good evening, everyone. Welcome to yet another session of extensive discussion on mental health awareness from Kachar Chronicles. This is Jennifer, your moderator for the day. I would like to request the other speakers to mute their mic when one of us is speaking because it echoes. Yeah. All right. To begin with, last year during the same time, Kachar Chronicles came up with a discussion on mental health, and we had an extensive discussion, and it was pretty good. The response was pretty good, and here we are after 1 year yet again with another discussion and another brainstorming session on mental health and how we have all uh, overcame the first wave of pandemic, and here we are again going through the second wave. So without further ado, I would like to introduce you with the speakers. We have an amazing set of speakers today. We have Dr. Rimi, who has been working in the front line. She is an emergency doctor, and currently she's practicing in Gurgaon. We have Miss Kanika. She is pursuing her MPhil in clinical psychology from Government Hospital Chandigarh, and we have Hanshit Deb. He is a social psychologist. He has done his master's in social psychology from University of Sussex, UK. So I welcome you all to today's session. So going straight away to the topic, mental health in India, or so as to say, psychology in India, has been introduced or has been talked about since the 1920s. Now, fast forward to 2021, it has been almost 90 years. But then, if you see the current scenario, India has come a long way talking about mental health, but then it is still in its budding stage. Now, with the outbreak of COVID-19, there was already a crisis of mental health in India. Like talking about statistics, we hardly have 7,000 clinical psychologists in India. This is a report from 2018. So this clearly shows how grave the situation is, or it clearly shows the crisis in India. So with the outbreak of COVID-19, it has somehow the crisis has doubled. If COVID-19 is a pandemic, mental health could be considered as an epidemic. So my first question is to Madam Kanika. What is your take on the crisis of mental health in India and as well as globally?
Okay. So if I'll talk about pandemic, then definitely it's a crisis and it's at global level, right? So when anything happens at global level, definitely this pandemic is leading to a lot of death, isolation, and a lot of mental health issues. And why this pandemic is creating such mental health crisis is just because a so-called mental health, if I go by definition, it's simply a subjective well-being. And in this pandemic, we are in a constant state of stress related to illness, stress related to family, and everything. Second, we are unable to do things whatever we want to do because we have been restricted. Number third, everybody feel that they are being unproductive at this particular point of time. So being as a human being, we have this tendency of being productive, feeling that yes, we can do things because that enhances our sense of self-being. But that is somehow has been restricted due to pandemic, And that is why in this scenario most of us are feeling poor mental health. And when we feel poor mental health, it tends to impact our day to day life. For example, you might come up with mental health issues, uh, or some sort of demotivation that you don't want to do work, or somewhere there is transition in the lifestyle also. So we are tend to follow sedentary lifestyle where we are like not we are not that active, we are more of passive, and a lot of addiction takes place. So when these things happening, secondly, uh, a lot of people who are sufferers or whose family has been suffered, they has been stigmatized by the society also, like they are COVID affected family, we should not go to them or we should not talk to them, somehow like that. So social discrimination is also happening, and social distancing, which leads to social isolation, and nobody wants to be isolated because we are human, social beings by nature. So that is how. And number third, what I believe is a lot of impact is being happened in terms of occupational functioning. If I'm a housewife and now I think I have to do a lot of work because more family members are there, or if I'm a student I feel unproductive because my schools are closed, so I don't find any purpose of, doing anything now. So all these issues are creating poor mental health, what I believe.
True, true, very true.
Hmm.
It's like it was already a situation where we were all suffering because India is lacking behind, to be very honest. But then again, the COVID has definitely added more to the distress. Now,
Hmm.
talking about distress, uh, the pandemic has hit every household, like be it the household which were directly affected by COVID or not. Indirectly, people's job, their relationship, their academics, every domain has been affected by the COVID. So 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 what I would like to know from Hanshit sir is that what are the different domains, and how has the factors like psychological, social, economic factors has added to the distress during the COVID crisis?
First of all, thank you so much for inviting me to be a part of this panel discussion. I'm already enjoying it quite a lot. To add on to the discussion, I think Anika has very succinctly described the collective psychological distress that we as human race have been experiencing for the past over a year now, actually. So, in context of India, what research has shown so far is that this pandemic has, on the social psychological level, caused problems on three different levels. So what it has done is that it has almost exasperated and expose the existing social inequalities and disparities that were prevalent in our society, be it in terms of economic, political subjugation, or your particular social standing in the social strata, be it caste, along the lines of caste, or be it along the lines of class, gender, whatever. Secondly, this pandemic itself has caused new forms of inequalities and disparities amongst the public, amongst the masses. Like, for example, we were able to see how migrant workers suffered so much because they weren't able to go back home last year. And thirdly, it has also caused some great, what's the word, like humanitarian aid induced problems, like because we are, I think it's a very wrong term to use, that we should isolate ourselves socially. Social distancing is a wrong word, because I think what has happened last year is that we have physically distanced ourselves, and that has taken a toll on our mental health, really. And I think organizations and government should have used the word physical, physical distancing rather than social distancing, right? So what this has done is that our existing forms of community relations, our existing forms of community solidarity networks have eroded over time, or have, if not eroded, they have taken a great hit because of the pandemic. So in this context, I would like to say that, since last year there has been this rhetoric present in our society that, oh, this pandemic has affected everyone, we are all on the same boat. While that is still largely true, it is also worthwhile pointing out that there may be some nuance to it, because how I see it is that we are not on the same boat. We are essentially under this under the same sea storm. And while some people have yachts and boats to fend for themselves, others are stuck with others are stuck with life jackets, and they're sailing in the middle of the sea, and they have no idea where they are going, and they are relying that somebody with a yacht will give them refuge. So yeah, that being said, I would also like to point out that so far research has shown that the pandemic, while it has affected everyone's mental health on a general level, there have been some groups that have been disproportionately affected by the pandemic. Number one would obviously be the patients who have been diagnosed with COVID, and health workers and frontline healthcare workers, etc., etc. Because, of course, like Kanika already talked about it, people who have been diagnosed with COVID face considerable amount of stigma and discrimination from society and their neighbors in general. Not only them, their family members also experienced the same. And on the other hand, doctors and frontline and all kinds of other healthcare workers have also experienced some kind of social alienation from the public. I have heard stories of doctors being asked to evacuate their place, like to leave their place by their landlords as soon as they found out that they were treating or seeing COVID patients. Not only that, because these healthcare workers are seeing death, loss, grieving every day, that is bound to have an effect on their mental health, right? And secondly, there is this one important phenomenon that has been observed amongst doctors, is that because the healthcare system is already so severely underfunded, under-resourced, and there is lack of manpower. So sometimes doctors have to choose between patients about who needs care right now, and that is bound to have some level of secondary traumatic disorder. I mean, there is PTSD already add to that secondary, because they experience tremendous amount of guilt, because you have to decide whose life is more valuable at the moment. And I think that is a very difficult situation that no human being should ideally have to face. um,
I
is
think
it
that
better now?
was,
The volume.
yeah, if the audience, if they could comment with a thumbs up. Are we clearly audible?
Hello. um, I'll just go on. I just have like last 2 3 couple of points make points to make. So besides the COVID patients and healthcare workers, like I already said, there were migrant workers, and migrant workers have experienced quite a lot of, like, great deal of psychological distress since last year. They were not able to go home, first of all. Secondly, they were already because they were living in a different state. The state was already inhospitable to them. There have been stories of how some of these workers were like living in cramped spaces of 5 square feet, and 20 to 30 people were living in the same room. And because most of these workers were men, they were not able to express themselves well to their family, because, well, men are not expected to cry. I mean, we all know that we are not expected to show our vulnerabilities, emotional vulnerabilities. So they essentially suffered in silence while the government completely overlooked their plight. Secondly, it would be women survivors of violence and abuse. COVID has clearly exposed how the Indian family structure is essentially hollow, and how patriarchy is so deeply entrenched in the way our interpersonal relationships are formed. So reports have shown that there has been a significant rise of increase in domestic violence amongst women, because now that they were stuck in home, these men who have access to their mind, body, and livelihood could completely dominate them. There have been stories about how these men in power within the family were spreading misinformation about the disease. Some of them withheld their access to medical health care or mental health care. Some of them were forget that some of them were even refusing them access to masks and soaps and sanitizers and things like that. That is the extent to which how things are bad at the moment. And finally, Jennifer pointed out in the talk initially, like people who already had mental health issues prior to the pandemic also suffered gravely because now they were unable to see their therapists as much. And this transition from face-to-face therapy to like telecommunication, telecounseling, and video call counseling have taken a time, and that definitely took a toll on them because they were unable to meet the support groups more frequently. Their access to counseling and other psychiatric medicines also definitely took a toll. And finally, another group that has suffered quite a lot were LGBTQ individuals, because now with the pandemic, many of them who had, let's say, previously left their home to live their lives more authentically in terms of their gender and sexual expression, now many of them had to come back to live with their families, where they face repeated abuse and stigma and trauma, or if they had not come out to their family already, they were forced to hide their identity once again, go back to the closet, or so to say. And that definitely caused a lot of psychological distress to them. And obviously, we all already know how difficult things are for them to, at the moment, to live their lives authentically, gain help, access help. So, yeah, things are pretty grave at the moment.
It is. And as you have already mentioned, doctors, the LGBTQ community, and also the people who are into substances are few of the groups which have been impacted very badly. So moving on to Dr. Rimi, she herself being a frontline worker who has seen death and survival and life the from a very close point of view. So one cannot, we as a general public, we have been dealing with our mental health and anxiety and hopelessness, but she being a doctor, watching everything so closely, that must have taken a toll on her mental health as well, and which is beyond imagination. So I would like to hear from her what is her personal experience as a frontline worker.
Thank you, Jennifer. Thank you, Team Kacha Chronicles, for giving us this portal. So, in one word, if I were to describe my experience as a frontline worker during this wave 1 and 2, one word description would be harrowing. It's been upsetting, it's been sad, it's been unsettling, and that's just to sum it up in one word. uh, like the first wave, because I was posted in Assam, so I didn't see many deaths. I didn't see cases which, were very serious. But the second wave brought me to Delhi, Gurgaon, NCR, and here we've seen around in a 24-hour shift, I have seen 27 deaths over one day. So it's difficult seeing that many deaths and knowing that you just can't help despite of being in a profession which makes us pledge that will help people no matter what. When you don't have anything to help the people with, it's actually very sad. Like uh, what was one change that I would see, what I had seen in my tenure as a frontline worker during COVID has been that younger people have, then percentage younger people getting infected by more severe forms of COVID, that is requiring ICU bed and ventilator beds, have gone up. Though statistically, ICMR data shows that there has been only a marginal increase in the number of young people getting infected by COVID-19 in the second wave as in comparison to the first wave. But in my experience, I have seen more number of younger cases, and even if in a family of COVID positive patients, because like what happened was the parents were vaccinated, the kid was not. So the parents had milder forms of COVID than the kid, and the kid required ICU admission, like a 18, 19-year kid. So that way it adds to the distress. We have lost many pregnant ladies because they were not getting vaccinated. So we've lost we've seen many deaths of pregnant ladies just because they couldn't be vaccinated. So their immune status was compromised. We've lost many patients with comorbidities like diabetes, hypertension, and that again brings us back to the more susceptible age group of above 40 years. So most of the deaths were above 40 years, but we have seen a 20-year dying, we have seen a 16-year-old dying, we have seen a 15-year-old dying. It's distressing. And more so ever when I am staying 2,000 kilometers from my home, my family tests positive, and there's no way I could go home. I have to be here, and and that adds to the distress. And like Hansit pointed out, that there are several instances of doctors being thrown out of their places where they were putting up as tenants, etc. So these are some problems that doctors have faced. I haven't, thankfully, till date, but many have. And yeah, this the death count, it would be wrong if I have to directly point out that there have been some statistical miscalculations, but yeah, there has been I can be this blunt. So because what happens is, I remember, like, in our hospital setup of 200 beds, there were times when patients would come in ambulances, and by the time we checked the patient in the ambulance and we informed the party that there's no bed, you have to shift the patient to another hospital, the patients had attendant had already taken them to 3-4 hospitals, and by the time they reached our hospital, they were dead in the hospital gate, and we had to declare them dead. And so these people took the patient back home, and their number could not be added in the COVID registry or database. That was, I think just half of the cases, I think, were not registered. So the number of deaths we see is not the actual number of deaths. The death could have been 5 times higher or 6 times higher than the number of deaths we see. And as doctors, seeing my colleagues, my friends, known acquaintances getting infected every day, losing someone or the other to COVID. This wave last year, I remember the first wave was from March to September, and this year it's been only 3 months of the second wave, and yet the number of death of doctors have in these 3 months is almost equal to the number of that we had seen last year in over 6-7 months. Last year, IMA data tells you that around 748 doctors died in the first wave, and it's only been 3 months of the second wave, and we've already lost 735 doctors as of yet. And that's only doctors, not including the other healthcare workers like nurses, GDAs, and pharmacists and laboratory technicians, etc. Pregnant doctors, young doctors, interns who just passed out from medical colleges, who had just posted in hospitals without adequate training, without adequate infrastructure, uh, without there are you've seen many violence cases, like the recent incidents I recall from Assam, where an intern on his second day of posting was hit by a mob just because he had informed the patient party that there was no oxygen availability in the hospital. So doctors had been at the receiving end in places where there was lack of infrastructure. So it's been harrowing reading these things every day and then going back to work again, trying to save as many people as I can. So it's, in one word, it's been distressing.
It is far beyond imagination, to be very honest, because unless you hear from a frontline worker who has seen everything so closely, you cannot really understand the dynamics that are being played out there. Also, like as you have said, the poor infrastructure, you might, as a doctor, you might feel that you have the potential, you have the capabilities, you have the energy to help out people, but then because of the infrastructure, because of the inadequate resources, you are not able to do your best, and that is likely to add more to your distress. Yeah.
Yeah, poor infrastructure, I hands-on agree to it that we've seen more deaths in India, and if there's one only one factor I'll have to point out, it will be from the lack of infrastructure or from poor infrastructure. Uh, right now, I'm working in a corporate hospital, so maybe I have faced a lot less this year. I think like my hospital is well equipped. There's ICU beds, and still we fell short in many instances. I can only imagine and think of the doctors who are serving in rural areas of the doctors who are working, probably one PHC is covering 10 villages, around 50,000 people, one doctor, one nurse, and I don't know how many beds, 5-10 beds. I can only imagine the plight of those doctors. But I would just like to point out a few statistics here, things here, that in India, this year the total case tally as of yet is 3 crores, and the death tally is 3.8 lakhs. And just imagining, even if 3 crores out of it, if even 1% is positive, texted positive, and let's imagine 3 crore, let's imagine like 10%, then 30 lakhs are positive. So, and 10% of them require maybe hospital beds, so even that brings it down to 3 lakhs. But the number of hospital beds we have is like 1.9 lakhs, so like less than half of it. And ICU beds, 3% of all cases tested positive require ICU beds, is what's speculated. So that way, our number of ICU beds is only 95,000 in a big country like India, where our population is 140 crores. The number of ICU beds is only 95,000, and 45,000, half of that, ventilators. And right now, projections are that just in case the third wave has to come in, just in case the third wave starts as projected by ICMR or the AIMS director, that it starts in the next 2 months, we would be requiring 5 lakh additional ICU beds. We have 95,000, not even 1 lakh. We need 5 lakh ICU beds, and we need 3,50,000 additional medical staff. How do you produce them? We don't even have that many number of medical students studying right now. How do we produce it overnight? So infrastructurally, we could have been better planned after the first wave. The government, the authorities should have known that a second wave was inevitable. That's how viral diseases, that's how pandemics occur. We should have been more careful. We should have started building infrastructure. We should have concentrated on that. So, like the statistics, the infrastructure is again going to fail us. If there's a third wave or a fourth wave or a fifth wave, infrastructure will never be adequate. But what we can do is by proper management. But I think that way also we have failed in many ways. Also, I would like to talk about the inequality in distribution of the hospital beds. It's not like the rural areas are not seeing COVID cases. It's not like the rural area people do not need ICU beds or ventilators, or like people from Northeast are not suffering, or people from South India are not suffering, southern part of the country. But there is inequality in the distribution of hospital beds. You see, most of the ventilator and the oxygen beds are concentrated in northern states like UP, for instance, Karnataka, UP, Maharashtra, Delhi. But the requirement is I think the geographical spread of COVID is almost uniform all across the country. So that way, the unequal distribution of beds, ventilators, and ICUs are also adding to the plight of the people. So yeah, infrastructurally, we still have a long way to go, but doesn't seem like the wrath of the virus is going to come down anytime soon. And overnight, we can build ICU beds, maybe 5 lakh ICU beds, but how do we produce 3,50,000 medical staff in 1 month? That's beyond my imagination.
It is indeed very devastating. And shifting the focus to mental health, there was this statistics which says that in India there are only 0.5 psychologists available for 1 lakh people in general. So how do you bridge the gap between the need and the provider? That's, I don't know how do you even come to the conclusion of providing mental health support to the mass. It'll take a lot. Now, moving ahead, the whole period from first lockdown with the subsequent unlock and then the second wave of COVID, every household has been hit, right? Every other person who I talk to has been feeling anxious, but the general public, we do not know the signs and symptoms or what is actually happening to us. All we know is that something is wrong, or our headspace is really disturbed. So this question is for Madam Kanika. I would like to hear from you the major symptomatology of the disorders or the distress which has been caused by the pandemic, and
Okay.
also how to recognize them, because not everyone is able to differentiate between so as to say sadness or depression. Not everyone knows how to differentiate because people are confusing between both the terms.
Hmm.
So how do you help us recognize the symptoms?
Okay. It's very important since it's a mental health crisis which has taken place. So I will say there are few common mental health disorders by research which are prevalent more in general population. So number one, it's addiction. I won't use very technical terms here because most of the people are general public. So I won't use technical words here. So number one is addiction. Addiction of anything. It can be screen addiction, phone addiction, online gaming, or substance, cigarette, alcohol, anything. So addiction, number one. Then second is depression. Like most of us know depression, where you feel loss of energy, you don't find interest in your pleasurable activities which you used to find interest in. Then there is change in your appetite, sleep disturbances taking place, and by mood, by emotion you feel sadness. Next category is anxiety, where you feel fearful or anxious most of the time, and it has different forms and levels. So either people tend to wash their hands multiple times, or they tend to start fearing going out talking to people, or they simply feel scared all the day, or worry about their health, that what am I if I get how should I manage myself, I might get covid, I should not do this, I should not do this. So every time they are occupied by that fear of getting covid or any health issue. Then another category is simple, that is adjustment, because pandemic is has prolonged and it's not a 1 or 2 day thing, it has been a year now, and we are in second year. So adjustment to it. So a lot of people find it very difficult to adjust to themselves because lifestyle has changed. We have shift from school going to online schooling, so everything has changed. And in children, I would say a lot of children are suffering because there are mental health issues in children as well, which we call developmental disorders. So those children, because they had a schedule, they used to go to their special schools, had classes, they are being impacted a lot. So a lot of ADHD children, children who are very hyperactive and they find it very difficult to pay attention, these cases are also rising up a lot. So these are some common mental health disorders which are prevalent. Now, how to identify them? Uh, it's very difficult to answer basically, because I just want to say that whatever I'm saying, please don't take it at a face value. Don't think, okay, if I don't sleep for 1 or 2 days, I might be suffering from some mental health issue. Please. So take it with a caution. Number one, sleep. Your sleep will get disturbed. You either sleep too much or too less, or you wake up in between when you sleep and you don't find have a quality of sleep. Second is your food appetite. Either you want to eat more or less, or you don't feel like eating. So there is weight loss also. Third sign is your hobbies. We everybody like to do something, either stitching, cooking, or working, household chores also, or studying, anything. So you don't feel like doing these things. And number four, you don't feel like talking to people. Now, it's not about introvert and extrovert. Even introverts have their circle. So you don't feel like talking to your own core people, or or picking up phone, or don't feel like being on social media, or whatever your way of communicating to people, that reduces. And there is lot of disturbance in your self care. You don't want to take bath, you don't want to take care of yourself, you don't want to wear good clothes. I know we are at home, but still we have to wear neat and clean clothes, comb our hair, and skin hydration, everything, so that things reduces. So these are some signs which one can identify. And most importantly, thoughts, because we are human beings who have thoughts, a lot of thought which goes here. So you have thoughts which are high in intensity and which come all the time, but it tends to produce an emotion, a feeling which is more of anxious or of sadness, or this self blame or guilty, or you are missing your loved ones. So these feelings tend to make you more, they tend to create that emotional turmoil in you that ultimately makes you more that you don't want to do anything now. So these are some signs and symptoms, and please check that they should not just of 1 or 2 days, because that things happen to everybody. Okay, sometimes we don't feel like doing things, but if these are persisting for weeks, for months, for 2 months, 6 months, then it's a matter of concern, and you should definitely seek help that time. Thank you.
Yeah. So now these symptoms are likely to arise from various sources, and there might be different sort of underlying factors. Now, this question is for Hanshit sir. Do you think the biological model or only uh, biological factors have been conceptualized when it comes to mental health, and other factors like psychological, social are not really considered? So, what is your say on that?
I think a good way to answer that question would be to sort of look at WHO's definition of health or well-being, because according to I'm not going to say it verbatim, but essentially what the definition of health according to WHO is that it is not simply the absence of any illnesses or disorder or any kind of pathology, but health or well-being is something more than that. That your the state of good health is not simply the absence of illness, but something more that you are leading a more meaningful, authentic, and productive life. You have good relations with your um, fellow human beings, etc., etc. So, keeping this in mind, I have to I have my own set of criticisms for this biomedical model. So, uh, according to the literature, there are two different approaches in which we sort of conceptualize mental health or mental illnesses. The first is the trauma approach. So, what the trauma approach does is that one very good thing that the trauma approach has actually done is that it has normalized psychological distress. So, it acknowledges the fact that when human beings are under severe stress in an emergency situation or in a state of pandemic disaster, we will we will react in the ways that Kanika has just very succinctly described in her explained to us in her talk. We will experience anxiety, we will experience symptoms of depression, we will experience PTSD, etc., etc., etc. The but the problem with the trauma approach is that it is also it is also creating unnecessary psychiatric labels, because like Kanika said, because we have been cooped up in our homes for such a long time and we feel unproductive, we feel down, low, upset all the time. That in itself is like, yeah, you're experiencing the symptoms of, let's say, depression here, but that in itself is not grounds for you to be diagnosed with clinical depression. Do you understand what I say? So yeah, that is one major criticism of the trauma approach. like in trauma approach, if you're experiencing this symptoms due to an extreme stressful environment, the immediate approach is to simply go and uh, address the trauma response, resolve the trauma here. When in reality, it is the solution should be directed somewhere else. I mean, we have to acknowledge that the environment itself is pretty stressful, which is why people at large are experiencing this. And one more point here is that he generally speaking, during pre-COVID times, we did on an individual level, we would experience this kind of stressful environments, right? We have pressure from work, we have pressure from universities, we have pressure from our family, etc., and that might create this kind of psychological symptoms. But you have to acknowledge that at this moment right now, all of us are collectively experiencing the symptoms at the same time, because there is a pandemic going on. People are dying, you're seeing death every day, either directly or on TV, radio, everywhere else. That is bound to have a negative psychological impact on you. So we must acknowledge that. Secondly, because a lot of the mental illnesses that we know of today have been conceptualized in Western societies. So oftentimes what happens is that these kind of for example, PTSD, something like PTSD might not be able to fully capture the social reality of, let's say, India, because there are a lot of other social factors and nuances present here, right? There are instances of some kind of specific somatoform disorders that are only particularly seen in, let's say, China or India. For example, Mata Char Jana hum jisko bolte hain, like that is very particularly seen only in India, or maybe even in northern parts of India. That is, yeah, you have conversion disorders, but they manifest themselves in various ways in other countries. All right. Secondly, there is the other framework is the diagnostic approach of conceptualizing mental illness. So in medicine or in psychiatry, yeah, it is very important to have a very standardized language of understanding mental illnesses, right? Be it DSM-5 or be it ICD-10. For if we are talking about clinical depression, yeah, we have a set of these symptoms need to be present. If there are 7 symptoms, 5 out of 7 symptoms need to be present in this individual over a period of 2 weeks for them to be diagnosed with severe clinical depression. That's great. But again, my previous point, this is a different time right now. We are we are amidst global pandemic. So when you when you take this diagnostic approach, you are taking a very reductionist you're taking a very reductionist outlook towards mental health, right? So when you do that, you are essentially ignoring the myriad of personal, interpersonal, social, political, economic factors that contribute to mental health. And there are severe large scale consequences of doing that. So when you take such a narrow approach towards understanding mental health illness, it is like somebody benefits from it, and that would be probably the pharmacological industries, because when you are depressed because of, let's say, these kind of grave social reasons than political reasons or economic reasons, you are ignoring the wide scope of non-medicinal or non-pharmacological support systems and help that is available out there for you. If you're like, see, there are one could say that there are two types of depression. One depression would be that a person has a great life, has a great job, has a loving wife, great family, everything is going well for them, but they're still depressed because their brain doesn't have enough dopamine receptors in there, and that is why they're experiencing depression. But in a case like the pandemic, or in a case where a person has just lost their job because of the pandemic, they are worried about how can they sustain themselves and their family, they will experience anxiety and depression, right? So we have to normalize it. I mean, maybe normalizing is the wrong word. We have to acknowledge and address this larger social factors. So since before you asked this question to me, before you asked this question to me, you talked about how can we address the gap. How can we address the gap? Like Remy talked about, there's just not enough infrastructure. There's just not enough medical personnel to address not only COVID related, specific to COVID related issues, but tertiary issues that have sprung up because of COVID. We have to strengthen our community ties here, because obviously, at present, if the statistics says that there are only 0.05 psychologists for 1 lakh people in India, even if we take a window of 5 years, 5 years won't be enough time to produce ample number of psychologists or other kind of mental health professionals to address this severe gap. So what we can do is that like organizations and government has to come up, and we have to we have to start psychoeducating. We have to create education for psycho. I mean, when I say psychoeducation, it's just that we have to talk about self-help strategies. We have to talk about forming support networks. We have to talk about mapping. If there is a person who suffers from anxiety in a neighborhood, or if a person suffers from depression in a particular neighborhood, people around them should be able to support them, and let them know that they're not alone, that they are there to take care of them, instead of stigmatizing and discriminating against them. So we have, instead of individualizing mental illness, I think if we take a more social and collective approach towards understanding mental health, which is the biopsychosocial approach, which has come out of many health human rights activism. Basically, I think if we change the general approach towards understanding mental health, and we start to address the larger social psychological factors at play here which contribute to poor mental health, I think that will go a long way in elevating our mental health in general. Yeah, that's all I have to say.
Absolutely, absolutely. Like India being a collectivistic society, when it comes to mental health, people have been uh, taking an individualistic approach. So mapping and recognizing the people who are suffering, and lending a helping hand, and for that matter, we have to start all these things right from our home. I think that would bring a change in the society. Now,
Right from your home, and also at a community level as well.
exactly, yeah.
I just had one point to add on to what Rimi said earlier about the statistics. Um, I think it is very interesting that we always say that, right, that when we talk about implementing and formulating healthcare policies, that we should listen to academics, we should listen to what intellectuals are saying, what research is, or what science is saying, essentially. I think what in context of that, we also need to be careful that science can only tell us uh, that if we do this, this will be the consequence of that action. This is the precedent, this is the antecedent, this will be the precedent. Science can only go so far as to inform us regarding that, but then science itself is not one you need like linear thing, right? There will be one study that will say one thing, there will be another study that might say something contradictory, right? So when research takes place on such a large level, the the government has to make tough decisions there. So the government needs to weigh out the risks. This is the risk that they are willing to address at the moment, and they can maybe sideline this risk, other risk for the time being. So at that point of time, that really becomes a political question rather than a scientific question. So yeah, I think Rimi would agree with me on that. So yeah.
All right. So now, going a bit off bit, my next question is for Dr. Rimi. Lately, we have seen a lot of violence against the healthcare workers in hospital setups. Now, you as a frontline worker, how do you deal with it? It has definitely left us devastated, and it has left us in a question, in it has left us surprised. So you being there, right there where everything is happening, how does it feel, and how do you cope up with that? As a medical fraternity, how are your colleagues, you as a whole, how are you people coping up with this violence against doctors?
Mm, there's no definitive way in which there's no guideline like with which we haven't been taught about how to deal with stress. We've read books on psychology, we've read books on psychiatry, but we were never told how to take care of our own mental health. And every other organization is coming up every day with one or the other guideline, but no one comes up with any guideline regarding mental health or how to take charge of your mental health when you are amid such distressing and horrifying work atmosphere every day. Um, how do we cope with it? Doctors, we talk to each other basically, because we can only talk to friends who are not in the front line, and we can expect their empathy, but only another co-worker or another person who's in out in the field will identify and understand what actually we are going through. We have each other is too cliched, but yeah, we talk to our friends, we talk to our colleagues, we talk to our family. That's that. Like, there's no other way in which we're coping with it. We've seen the number of a few. I wouldn't say many, but a few doctors have also given up. Like you know, when I say given up, I mean they've committed suicide or tried to end their lives, or many have left their jobs. Many. There's no data. There's no statistics. But if we were to actually do a statistical study, we would see that many doctors have dropped out of their jobs because it's simply too much, too demanding, and this what you lose is yourself. You might just die out there. Go there and die, and then media is adding to the frenzy every day, and Google is not helping. Every day there's at least, like, out of the 20 people we see, at least 15 will come with self diagnosed conditions sourced from Google. So, and
If
that's
you
that.
if to add something, if you feel that you're suffering from something and then you Google it, either you'll be dead or either you'll be on the safe side. There's nothing
Yeah,
in between.
yeah. Like, Google is like, for headache, if you Google, you end up in a brain tumor. So I would only have, what happened now, how uh, I would also like to talk here about how media is not helping us in under such situation, how media is adding and creating a frenzy,
Yeah,
adding.
I was about to come to that point. Like, media as a whole has evoked a general anxiety in
Yes,
everyone, be it
yes,
talking about our senior citizen or parents.
yes.
When they watch newses of death, it has
Hmm.
a normal, not I would not use the word normal, but a fear of death has overtaken them.
Yeah,
So a
every
lot of
day.
them is coming from media.
So these are under researched media. The media is not doing their research. Media is just looking for TRP, and so every day there's one color of fungus coming up. Some day it's yellow, some day it's black, some day it's white, it's green. One day it will be a rainbow fungus, and people will come asking to us, like, what's a rainbow fungus, how do we prevent it? So see, these fungal infections, every day we hear black fungus. First it comes out like it's black fungus, and then they say it's white fungus, and then they now they're saying there's a yellow fungus which is more fatal than black and white, and people are stuck in between these terminologies. No one, neither the media, and we obviously have our own limitations. We cannot go out and preach, like, we cannot tell them that these were there since before COVID. These were there since days of yore. White fungus is candidiasis, which probably, I don't know, many of us have had in our lives. This comes from, poor oral hygiene or something like that. It's as basic as that. White fungus is nothing. Like, that day, I will tell from my practical experience. One of my friends called. His mom was post COVID, and he says that uh, my mom has this symptoms, and I tell him, so she has candidiasis, and he goes off, okay, what do I have to do? I say, okay, betadine gargle, and uh, maintain oral hygiene, let her brush 2 to 3 times a day. That's that. Like, rinse her mouth twice daily, and he goes away. And like 2 days later, he comes and says, okay, my mom has candidiasis, it's healed now, my dad has white fungus and he's going to die. And then I'm like, no, your mom and dad have the same disease. White fungus gives you anxiety. Candidiasis makes you calm because you think, okay, this disease has a name. So, that kind of thing. Media is adding to the frenzy. Media is not helping. Um that way, I think we should all keep ourselves away from these under-researched and anchors shouting at the top of their voice like Sansani case Vardat and all. We don't need Sansani case Vardat. We don't need Google. We don't need media. Like, you know, these are like, it's not helping. It's not helping because every day, uh, see, we already have a big, what I would like to emphasize on here is we already have a big chunk of people who need our attention as doctors and as primary healthcare providers. We have a big chunk of patients who are COVID positive, who are coming with post-COVID complications of fatal aspergillosis, which is like the black fungus, etc., etc. And then that's only 50% of the cases. 50% of the cases are the post-COVID people with who just come to us with like, I have the symptom, probably I am having black fungus, I'm going to die. So that way, it also is draining manpower, which could have been used in concentrating on the other 50% of the genuine cases which need our attention. So that is how media can help us that way, by educating people regarding that these are not fatal, these require a doctor's consultation and not your self-made diagnosis. Yeah, so on and so forth, I think. Otherwise, when it comes to doctors coping with their mental health, I think we are doing quite good in that. It's been 2 years of dealing with the pandemic. We've had no lockdown. We've had no, we didn't get, we went bored because we didn't get to stay at home. We had to go to work. Everyone was making Dalgona coffee. We still had to go to work, sadly. But yeah, I think going to work, coming back at the end of the day, thinking like, okay, I could save one life. That, and alongside talking to our colleagues, talking to them about the grim situation over their place, and like that way we have each other. We are talking to our colleagues, but at this point, I think the government, the authorities of the hospitals we are working in, they could help us in that. There could be a cell, a psychological, a psychological support cell or a number where any doctor in distress could just dial and talk to a counselor or something like that. I think that way it could help, but sadly, I don't think we have that. Maybe one or two isolated hospitals have that, facility for their doctors, but nothing nothing like a national helpline number or something like that. No distress number we have for ourselves. So
There are groups, there are individual groups, certain groups that has come up with these facilities of consultation. Even RCI has released a list of some 350 counselors, I guess, few months back, and they are asked to provide free counseling services, but then it does not reach the mass. It's somewhere
exactly
lost.
what media should be doing is should be spreading these news instead of that black fungus, white fungus, rainbow fungus. But
Exactly,
media is
and
doing something else.
it never reaches the mass. People are like asking for help, but also there are helpline numbers which are not being used, so it's somewhere lost out there. Now, moving ahead, since Madam Kanika has already elaborated on the symptomatology of different disorders, now how are we, as general public, what can be done? How do we bring change? And could you help us with some self-help strategies?
I would say that I totally agree with Dr. Rabi. She's right. Google, media, and doctor. Self made diagnosis. Everything is just creating chaos, basically. This knowledge is basically to, clear your thoughts so that you can make informed decision. But this information overload is doing the opposite. So I would say that to all the audience who are watching, kindly believe in yourself, please. योर वो जो घर के नुस्खे होते हैं और जो एक ट्रेडिशनल शेड्यूल चल रहा है ना हमारी जिंदगी का, दैट इज द बेस्ट की टू लिव अ हेल्दी लाइफ. सो I will just point out few things that as an individual what we can do, whether you are doctor, or student or homemaker or anybody, what you can do in order to ensure a good mental health. So number one is definitely your sleep. uh, Regulating your sleep is very important, waking up at particular time and then sleeping at particular time, because your biological functions are important. So maintaining sleep is important. Second is food intake, because we are in a crisis situation, and rather than Google or money, right now we need a good physical health. So maintaining immunity is very important, and balanced diet is the key. So, and since everybody is at home, so you can always take advantage of having balanced food. Then following regular routine. Everybody, even if you are a small kid or you are an old, everybody has their routine: waking up, doing exercise, then household chores, then whatever. So you should make, a timetable जैसे बच्चों का होता है, and you should follow that, because in the end you will feel that, oh, I did these things today, and somehow it will, uh, make you feel that yes, you are being productive. So productive to yourself basically, so that is important. Then definitely we can learn new skills. It's time, and everybody's saying fine, you're not going school online, classes and job, but you can learn new skills. There are so many things you can learn: stitching or cooking or repairing, anything, because this lockdown has made us realize that it's important to become self sufficient, self reliant. We can't call electrician now because of lockdown, or cobbler for very simple things. So you can learn these small basic life skills. And people who say that, ma'am, we have very monotonous schedule, we don't have anything, work and household chores and everything, I would say you can develop new skills or new hobbies. Basically, we can always, develop new things. You can learn language, you can learn any instrument. So I would say that technology, it's good that we are in technical era. So make use of it in a productive way, rather than just binge watching, or watching all news which tend to enhance your anxiety. Reduce that. Then you can always go for online social interaction or virtual talks like we are having, or with your family members and relatives. So that will enhance your well-being, that you are not alone. Yes, we are physically at distance, but socially we are all connected. So that connection will form, and you will feel that social harmony is still present even in COVID times. Then you can always uh, seek help from therapists or counselors. There are online platforms available for seeking simple counseling or psychotherapy, and there are helpline numbers where you can simply just talk, they can listen to you. So you can make use of these facilities. And definitely you can work at home, and I know minimal or what maximum, but you can work at home and make yourself productive, simply. Yeah, that's what I feel.
We have a couple of questions here. We'll be addressing them. But before the question answer session, my next question is for Hanshit sir. So this pandemic has, evoked a lot of concern about among the general public, be it academic demotivation, or job, looking for a job, small businesses coming down, people are people are feeling hopeless. So would you like to throw some light on the psychosocial concerns among the general public? Sir, your mic is off, I guess.
Sorry.
Yeah.
So since you and Kanika already talked about the presence of various telecounseling services and psychological services available online that are out there, so one such organization is ICOL, that is, I think that was initiated by TIS Mumbai. So they have come up with the research, and they have come up with some like very succinct things about the general psychosocial concerns of the public. The first concern would be obviously about the pandemic and the consequent fear that arises out of it, because every day we get to hear new information about the uh, pandemic. We as general public and also as medical professionals and scientists, because they're still trying to figure out the nature of the virus and how it mutates, and we are just learning as we go along the way, right? And that creates a sense of anxiety amongst both intellectuals and general public. And to add to that, we have already talked about the media, the role of that the media plays in general. As a social psychologist, I would just like to say that research has shown that, yeah, of course, we should keep ourselves informed about uh, the basic things that are like, okay, yeah, that there's a pandemic, we should practice physical distancing, we should wear masks, we should sanitize ourselves, we should get ourselves vaccinated as soon as possible. Yeah, those things are great, but at the same time, there are negative consequences to overloading yourself with information. And 20, 30 years ago, there was only newspaper, TV, and radio, but now we have social media. I know it's quite ironic that I'm criticizing social media on this seminar itself, but what social media does is that since they don't have the owners to do proper research, they can literally overload and shower us with whatever bullshit or whatever conspiracy theories they can come up with, right? And when we receive so much information, we will either shut ourselves, or we'll go into panic or anxiety mode, or of the fight or flight mode that we know in psychology. And the other ways in which the media has really messed up is um, creating using a very divisive language. For example, they would use words, very hot words like COVID hotspots, COVID suspects. This language is like, we have to take a very critical look at this kind of language, because this kind of language actually creates stigma and discrimination amongst the public, right? Second would be something that Rimi already touched upon, would be I would just try to present the counter picture of that. It would be the general public's disappointment with the health system. So, of course, we in India already know what the situation of the healthcare system is like. So, at iCall, people would call them up and talk about their unpleasant and disheartening experience with the healthcare system, the dearth of availability of testing centers, and how reports are often botched or reports are lost at times. That creates additional anxiety. Then there is oftentimes delaying of reports. Then there is what's the word for it, like negligence on part of doctors. And of course they are small in number, but I think we have to also keep in mind that the problem here is structural in nature. It's not that the medical health workers are doing the best they can. There is a reason we call them warriors. We have been calling them warriors since last year, and that title is very well deserved. But there is only so much that they can do if they don't have the backing of the government. They don't have enough resources to deal with that. So basically, because there are not enough resources, people are being pitted against the healthcare system, and that is not a helpful situation here. I mean, we will not go anywhere with this situation. Thirdly, there are obviously economic and professional worries, practical concerns, and disruption of life plans, especially amongst young people, because this is the age group, young students and young adults, who who are, let's say, living away from home, living away from the family, studying, working, because they have to take care of their family, they have to earn a livelihood, they have to take care of their elder parents, and that creates additional anxiety. They have their whatever plans they had made to make a next career move has been disrupted. They wanted to get promotion, they wanted to get a new job. Think about the students who are still in school, who are paying for their 12th boards. We all know what's happening there. So now they are worried, why should we study at all when we know that we're all going to die anyway, right?
Absolutely, absolutely. Also, this uncertainty, because exams are postponed. We don't know when for a student who is in his or her terminal stage for graduation, or say the people who are in class 12, they don't know if their exams are going to be held or not. Until recently, we got to know that it's not going to be held. So
Yeah.
Like
And the last,
there's this constant uncertainty which has taken over everyone. Me
yeah,
being a student, I can say that.
definitely. And the last 2 points would be about how this pandemic has affected our intimate relationships and expose the cracks in our family structure and dynamics. So there are two things that have come up. On the one hand, some people are facing forced isolation because, like I said, they're living away from their family. They have become completely alone. While in other cases, they are being forced to live with their family, and they're forced to live with the family in the sense that because our the Indian family structure is very different from that in the West, right? So because we oftentimes in our Indian families we don't have a concept of personal boundaries. Like if a teenager or if an adult closes the room in their door and does whatever they want to do, like, ऐसा क्या है जो तुम दरवाजा खोल के नहीं कर सकते? And that is definitely that is definitely not healthy. And small things like um, who will do the household chores or doing household chores in excess or not doing household chores in excess or who can go out when to get groceries. These very generic and mundane things have become causes for conflict and fight and arguments amongst family members now for those who are living have been living together for so long in cooped up spaces. So, and like I already addressed earlier, because of this horrendous situation at the moment, it is women and children who are facing quite a lot of domestic abuse at the hands of other family members. So yeah, it's bad. It's bad anyway.
In that case, the list would go on, I guess,
Yeah,
because
definitely.
every household has a different story. Yeah. So now we begin with the question answer session, and we have quite a couple of questions. So the first is Shorojit Das. He says, "What if there's another complete lockdown? How can we mentally tackle that?" The question is open to both of you. I think we lost Miss Kanika. We'll add her. We'll try to add her. Dr. Rimi, would you like to answer?
There are chances that if the third wave comes in, probably there will be another complete lockdown. But that's I don't know. That's solely under the discretion of the government. But meant to mentally tackle that, maybe the points that Miss Kanika had noted out, like engage in your hobbies, connect with your families, connect with your friends, use social media, uh, to keep track of your mental health by actually engage in simple activities. I think the psychologist on board will be able to give us a more insightful explanation. So yeah, over to you, Hansit. Muted, yeah, Hansit.
I I I lost you guys for a bit there because of the internet connectivity. Sorry, I couldn't.
Yeah. So the question is, what if there's another complete lockdown? How can we mentally tackle that?
Okay, so I think that is a question Kanika has kind of partly answered to us in her previous talks about how to, like, if you are experiencing psychological distresses, you have to keep in mind that this is very well just psychological distress, that this is not grounds for you to diagnose yourself with any particular abnormal psychological or like psychological pathology. You experiencing symptoms of depression is not equal to you being actually depressed. So like Anika's I mean, what essentially you can do here is that you can practice a self-help strategies, like you can maintain a mood journal, maybe if a thought journal, you can, and also not just maintain a thought journal, read what you have written, and then try to read through and analyze your thoughts and see what are the sources and triggers for you, where what kind of stresses are causing you panic, what kind of stresses are causing you symptoms of anxiety, and see whether the text that you've written follows a logical order or not. I mean, that in itself gives us a lot of clarity. And definitely now would be a great time to engage in hobbies that you have not engaged in for a long time. Maybe you have a guitar that you bought 2 years ago that you never got a chance to pick
Terminal
up.
stage.
So
Exactly.
yeah, definitely.
To be precise, it would be like recognizing your trigger point. That's how you can go ahead with working on them, right?
Definitely.
All right.
Hmm.
The next question is, after recovery from COVID, how to deal with the post-COVID stress? I would like to ask Ms. Kanika to go ahead with the answer.
Okay. Am I audible?
Yes, you are.
Okay. So I would say that COVID is just like any other illness, like diabetes or BP. So after COVID, you have to look for symptoms. So definitely, if you're having that number of symptoms, which says that if you have these symptoms, then you are, prone to COVID, or you are COVID positive. So that is why you can always check for those symptoms, and then it's like any other illness. So because we have come to know it is pandemic definitely, but it is like any other illness like diabetes, BP, or anything. So v- uh, government and scientists are working on it. Vaccines have come out, treatment is going on, doctors are trying their best. So I would say that please don't worry and don't take stress. uh, we everybody is trying to work on the illness. So post COVID stress is very natural to take place at this point of time, because we are still in ongoing phase, we are still discovering things and in making things. But you can always look for those signs. If you have that, you can definitely go for checkup and get yourself treated, because if you have recovered from COVID, that in itself is a sign that it can be recovered and you can become all right once again. So that's a statement from my side.
Okay, the next question is from Kaushik Kanugo. When we all know that hospital bed is not going to treat the patients, can we approach to MCI for foreign students who are preparing for MCI screening tests also be a part of the present healthcare system? Yeah. So I think Miss Dr. Rimi can take that question.
Right now, we do not have MCI, sir, just for information. It's MCI is dissolved. We have NMC now, National Medical Council. And so efforts have been made and recommendations have been sent. I myself, being from Indian Medical Association, Junior Doctors Network, we have sent recommendations to the government regarding how a big chunk of our doctors who have trained abroad or who have studied abroad and are just waiting for their FMCG, which is Foreign Medical Graduates examination, to register themselves in the Indian Medical Council and start practicing in India. So they are waiting for their exams because that exam has been postponing, just like all other exams. So we have talked on behalf of all the FMGs, foreign medical graduates, regarding if they can be inculcated into the system, they can be brought in the system, and that way the maybe we don't have many, like around like how many foreign graduates we have, like 20,000, 30,000 maybe. But even adding 20,000 doctors to our system will actually help. So, and but these doctors are wanting to go out and work. It's not like they don't want to. They want to sit in home and relax and So yeah, so we have approached the government on their behalf to either conduct the FMG exam sooner or on the scheduled dates, which is probably July, or to let them practice intermittently for the time being, and then like maybe later let them sit for their exams. And just to encourage doctors to come and work, the foreign medical graduates to come and work in the Indian system, maybe also introduce something like a grace mark. People who work in COVID situation, they get either a remuneration or extra remuneration, or they get some grace marks in the exam which qualifies them to practice in India. So this has already been done. The motion has been put forward in IMA. IMA is still working. Indian Medical Association is still working on this regard. So let's expect some good news. So thank you.
We have yet another question for you, ma'am. Are people with
No.
pre
No. The
Yeah.
only diseases which compromise on your immunity, which lead to an immunocompromised state, only those people have a higher risk or of developing a COVID infection. For instance, diabetes, people with heart conditions, people with chronic kidney disease, with people with cancer or undertaking chemotherapy or radiotherapy, people with autoimmune diseases. Only the people who have immunocompromised states are more are exposed to more to COVID-19 infection or have that's why these are called as comorbidities. But otherwise, mental disorders as such have not shown any such increased incidences of COVID-19. Uh, uh, because this mental disorder do not do not influence your immune system. Otherwise, only immunocompromised state diseases are said to increase your risk of contracting COVID-19 infection.
Would anyone like to answer this? I think Miss Kanika would be able to answer it.
Rajveer Dev, many people. This question, no? Okay, so it's a myth that sadness is depression. What's the difference? Okay, so sadness is part of depression, and depression, please, I'm saying it's not an adjective and don't use it as a slang. It's a clinical term, and depression in itself is a clinical disorder. Okay, just like diabetes, cancer, anything else, it's a disorder, and sadness is one of the symptom of it. So sadness, lack of interest, loss of appetite, or loss of sleep, and lot. So these are symptoms under depression. So this is the difference. One is clinical term, and sadness is just a symptom under it. That's it. Thank you.
How do we talk to the children about coronavirus without making them anxious? Would anyone like to answer that?
I can take this up.
Yes,
Are you
yes, sure,
guys?
sure.
Okay, that's very interesting question, and it is so relevant. Uh, Coronavirus is just like any other thing. For example, I just want to give a relationship so that you can better understand it. So for example, children reach their puberty and they have so many sexual changes which take place in their body. And how do we taught them? How do we make them realize that it's normal and it's okay? Your body is getting changed now, and girls will have menstruation, boys will have sperm production. So how do we make them realize that it's normal? So in similar way, you can tell them about coronavirus because it's new for them, definitely. So you can tell them that it's a pandemic. I mean, we should educate them about real life thing. It's a pandemic, and what does it mean? And we we have to take care of ourselves, just like our soldiers. And we have to how do we have to take care of ourselves? By taking proper diet and sleep and everything. And then uh, if you have built your good immunity, then you can take care of others. So you can take care of your family, your parents, your grandparents, your friends, everything. So in that way, you can always tell them what coronavirus is, because it is important and it is going to exist. So children should be psychoeducated about that.
Sir, would you like to answer this? What is the role of parents in dealing with children who are in their terminal stage? Or maybe Dr. Rimi could answer.
Terminal stage with respect to what? The exams or the diseases? What?
Oh, yes, that
I'm,
makes
I'm, I'm,
sense.
I'm, I'm very sorry. I just have a question to ask to whoever is asking this, ma'am Nilanjana. Terminal stage and with respect to if exams, parents just I don't know how to deal with it. I don't have a child of my own
It's
yet,
just, I
but
think we just wait. I think we just
yeah,
wait.
we just wait. We don't add to the stress, because I think the children are also distressed in that they're not getting to go to schools, they're not getting to meet their peers and friends, they're seeing each other only online. So I and if they where going to appear in some terminal exam, probably they have prepared for it, or like the parents seem to get stressed. I've seen people from my personal experience. I've seen people saying, like Arey, his 12th boards are postponed and he doesn't study. He sleeps all the day. Let him sleep. I think like when the exams will be there, they'll start preparing again. But for now, I think it's no use like projecting your frustration above over the children. I think they should let be, like, when exams are there, they'll appear for it.
We have few more questions. What mental health and substance use disorder interventions can be provided in relationship to COVID-19?
So I'll take up this question. Since you're saying that substance use disorder, so I would suggest that for substance use disorder, you can seek consultation, direct consultation, psychiatry. Since tele OPDs are running and e-Sanjeevani has been come up, where you can through online medium, you can consult psychiatrist for the same, and they can prescribe you the appropriate medicine for the same, and that way your treatment can begin. And if need required, definitely you can get yourself admitted in the wards, because ward admission is being taken place but in a limited number, so on emergency basis or the need basis. So on that note, I think because it's a disorder, so for that, acute symptoms will be there and management in terms of medication is required more than in terms of therapy. Hansit, you can add to it.
Yes, and those are very good points, Kanika. And I think along with that, especially with regards to substance use and addiction, I think there is there is also a need to prepare a cadre of psychosocial care workers at a community level. We have to provide psychoeducation to, I mean, mental health professionals and organizations can come up and they can provide psychoeducation to the general public, and they can create, a cadre of community workers, volunteers, family members, self-help groups at, let's say, a block level or at a district level. These kind of systems already exist in some rural areas in India. I think we can learn from them and implement it on a national level, from a national level to like simple uh, neighborhood level or a block level across the country, because like realistically speaking, it would be impossible to admit everyone to OPDs and send everyone off to legit proper psychiatric health rights, I mean assistance rights. So yeah.
Also, like there are support groups and Alcoholics Anonymous, like uh, where you can go and talk about what you're going through with people who are into substance, right? Be it smoking, be it alcohol or any such other substance. Okay. This question, I don't know how to answer that. I think it's a bit offbeat and it's kind of political, right?
Like
Yeah,
I
it's
said
kind of
earlier.
political, but here I would like to just add a point. So I think state governments are in a hurry. I think the state governments are like regularly monitoring the number of cases, positivity
Mm.
rate, the number of red tests or the RT-PCR tests conducted, and the number of hospitalized patients, the number of deaths, the number of hospital beds occupied. I think they monitor it, and then according to that they lock down or partially lock down or keep on opening stage by stage. Delhi for now is open because there are people are not testing positive in Delhi anymore. So I think they do it after some, like, checks and things. But government acting so naive, I think someone from the government will be able to answer it. more appropriately, or like more honestly. But what I think is
True.
it goes through a lot of quality checks before they uplift or ban or a curfew or something like that. But yeah, I think it's
This
a
will
very
also
political
really,
question. Will it be wrong to
yeah.
consider that only children will be more susceptible? It is wrong to consider that only children will be more susceptible to third wave, because we had expected, or it's being speculated that the second wave will see more number of young people being positive, but it's not like that. It's been only a very marginal increase in the number of young people that have suffered more from COVID, because it was speculated that because people above the age of 45 were getting vaccinated, people above the age of 45 and 60 were getting vaccinated by first and second dose. So the younger masses will be more susceptible to a second wave, but that didn't happen. The age group, the comorbidities are anyway seen in the age group which is considered more susceptible, which is above 50 years, above 40 years. 70 to 80% of the cases were still people above the age of 40 years. So, and children anyways have better immunity. So nothing solid that proves that children will be more susceptible to the third wave. I think still the basic science which is involved in the mechanism of the pathophysiology of COVID, that immunity, the people who have lower immunity will get inflicted with it, no matter what's the age group. Even we've seen children suffering from COVID in first and second wave also, but that's solely a game of immunity, nothing like age group or something.
Well, with that, we come to the end of question answer session. And I would like to ask Hansit sir for a closing comments on why is it okay to be not productive, because each and every one of us are kind of having this conflict in mind, okay, to be productive or not. Like, we are constantly in search of, doing something productive, but at the end of the day we fail, I guess. At least I fail. So, and there are other people who will agree to the same. So what is your take on that?
I think uh, what happened when we were hit with the pandemic was that, of course, lockdown was enforced across the world, and now that we were at home all the time, we thought that, oh, we have more time than ever that we did before. We don't have to commute long hours to go to work anymore. We don't have to spend endless number of senseless hours at the office anymore. So we would be able to do more, be more productive. But that hasn't happened, and research has even again once again shown that productivity amongst workers has gone down, and even the motivation to work amongst people has also gone down. And there are reasons for that, because like at least amongst mammals, when we are in a state of panic or in a state of emergency, like we will either take a fight approach or a flight approach, or a freeze approach even. And freeze approach is something that has been observed amongst people. Like people, there have been patients who have said that they feel so disassociated with themselves. They don't feel like doing anything. They just want to sleep or lie down on the bed, and they feel guilty about it. And there is a reason for that. That's because we live in a culture, we live in such a society and a work culture where we constantly determine our self-worth by our ability to produce output or capital. And that output can be of by any measure of your ability to earn money or your ability to score well in your like marks, in your academics, whatever be it. I mean, for me personally, it was such a distressing and unpleasant experience to use the internet, because internet since 2020 has been filled with listicles and videos about top 10 tips to make yourself more productive during COVID-19. Or you have these influencers coming up with uh, videos, IGTV videos and live streams about this is how I spent my time in the lockdown by being productive. This is what I do, and this is what you should do as well. Why? I mean, you have a different life. I have a different life. My circumstances are different than yours. You are clearly a rich girl from South Delhi who doesn't have to worry about earning her bread every day. I I don't have the same. I don't have the same condition, right? So yeah, it is very funny. And also, like I was being way too harsh to influencers there. Sorry. I mean, influencers have to plan out their content in advance, so they do a around the clock uploading of things, and we think that, oh, this is how they spend their time and all the time making content. That's not how it is. They plan their content way ahead in months, and but we regular people don't live our lives that way. So yeah, in that sense, I would like to say that now is the time that we should, now is the best time probably for us to, just sit down, relax, and spend some time thinking about how we would want our lives to reshape in the next few months or in the next year, what we want from ourselves, what we want for our future, because this unstructured time is not visible, it does not produce tangible output. We feel that we are wasting our time when that is simply not true. You wish I personally feel that if more people spent more time with themselves, thinking and introspecting and reflecting, this world would genuinely be a much better place to be in, because there will be less interpersonal conflicts, there will be less communication, less miscommunication, less misunderstandings. Right. And yeah, once again, I would like to remind people that you are worthy. Like, even if you don't work for 2 months, even, you are still worthy of love, you're still worthy of affection. Your life is not meaningless, your life is not a waste. So don't feel guilty about lying on the couch and staring at ceiling for 2 days straight. That is completely fine. We're going through a global pandemic. You have lost your loved ones, or at least you're seeing people losing their lives. You will be affected by it. And lastly, now is also the time to reach out to your loved ones the most. Reach out to your family members, talk to your family members, talk to your friends, organize Zoom calls, organize Zoom, or attend webinars like this, learn as much as you can, and talk to people, because this is a pandemic that we obviously, while it has affected our individual lives, this is something that we are also facing collectively as a human race in our lifetime. We have never experienced anything like this ever before. Maybe in the 1920 when there was Spanish flu, but you cannot go through this alone. We have to deal with this together, stand together, and that is the only way there is any hope that we would be able to get past this pandemic. So yeah, thanks.
True,
Thank
true.
you.
Very well said. And it's already been 1 hour 36 minutes, so we wrap it up. I
Just
thank. Yeah,
just
yeah,
just
yeah,
just
sure.
just one last point I wanted to make. Sorry, it went out of my head. Was that, you know Steve Jobs said that, he has this famous quote that don't think, just act. And while that may be true for Mr. Steve Jobs particularly, because he spent his entire life wanting to be a millionaire and he did a great job at that, but I think the problem here is that that idea is being sold to us every day, that we too should aspire to earn as much money as we can, and that is not true, because we should aspire to live our lives in the way that is more meaningful and genuine, authentic to us. And the only way you can do that is, like I said earlier, spend more time with yourselves, think deeply, introspect yourself. So my quote to the public today would be, don't act, just think. So yeah.
All right, all right. So yes, I thank all three of you to you have taken out time out of your busy schedule, at least speaking about ma'am, because she is working. And yes, yet again, we are done with another session of mental health awareness by Kachar Chronicles. It was very nice to have you with us, and we had hit we hit a number of viewers today. So with that, I would just say to all the viewers who are watching, like, this pandemic, the outbreak of COVID-19, it's like a storm outside, right? Right now there is a big storm outside. So hold on to something very, tight until it gets over, and then go out, and things will be fine, I guess. That's everything I can say at the end. All right. Thank you everyone for watching and joining us.
Thank you.
Thank
For
you.
having us. Thank you.
It was great. Yeah.
Yeah.